Hello everyone, this is Abel Gitai,
This is Julia Sherry.
and together we are here to present our speech on the cultural aspect of stigmatization, mental health prevention, its diagnosis, treatment, financing, and advocacy.
So I'm going to take you through the first three aspects: that's stigmatization, prevention, and diagnosis of mental health. To start with stigmatization, every culture has a different way of looking at mental health. For many countries, including Kenya, there's growing stigma around mental health, and mental health challenges are considered a weakness and something to hide. Stigma often comes from lack of understanding. Inaccurate or misleading media presentation of mental illness usually contribute to both factors. There are three types of stigma, that is, public stigma, self stigma, and institutional stigma. So, in public stigma, we find that there are negative attitudes towards those with mental illness. Self stigma is when one has an internalized shame that hears about his or her condition. Institutional stigma involves government policies that intentionally limit opportunities for people with mental illness. For instance, lower funding for mental illness research or fewer mental health services compared to other healthcare. There are harmful effects of stigma and discrimination. For instance, reduced hope for the mentally ill, lower self esteem, difficulties with social relationships, bullying, physical harassment, and social isolation among those with mental illnesses. Stigmatization does not only affect an individual suffering from mental illness, but it also affects their families and those who are around them. There are so many ways that a community can figure out to address mental illness corresponding to stigma in a community. Such include speaking out and sharing your story, having contact with individuals who suffer mental illness so that you can be able to relate more of the conditions and also of the symptoms, conducting anti-stigma social marketing campaigns through radio shows, road shows, journals, magazines, and also TV shows. Choose to empowering yourself over shame. That is for those who are mentally ill. You can choose to be empowered and not to be ashamed to talk about your condition. You can also educate yourself and others by sharing facts and experiences to shun misconceptions and negative comments about mental health. And this can be well done through the media where you can or get all the information and all the facts about mental health. And you can also use the same media, example, social media platforms, to educate other people about the facts of mental health so as to do away with that misconceptions and myths about mental health. The next point I'm going to talk about is prevention. Prevention can help all of us, whether we currently have good mental health or not. We all have mental health that changes depending on what's happening in our lives. There are three types of prevention, rather. There's primary prevention, where it aims at stopping mental health problems before they start. Example of this primary prevention can be anti-stigma campaigns that I've just talked about, educating children about emotions and mental ill health when they're still very young. Secondary prevention includes uh, secondary prevention includes supporting those that are high risk of experiencing mental health problems, and these people include those that have experienced trauma in their lives, those that may be bullied due to their uniqueness, for example, those who are in the LGBTQ group, those that have suffered long term physical ill health that may render them mentally ill to some people. There's the tertiary prevention level, where it helps people with mental ill health to stay well and have good quality life by helping them reduce their symptoms through medication and interventions, empowering them to manage their own well being, reducing the risk of relapse, that is, You can find a way of helping them not to go back to their situation that they were in before they seek medication. There are changes that the Kenyan community in particular can make to prevent mental health problems. These changes include helping parents to nurture their children, protecting children from traumatic events, reducing loneliness for older people by perhaps creating homes for the elderly where they can have people coming to visit them, to do away with that loneliness, caring with caring for people with suicidal thoughts, and building connections in our society. The last point I'm going to talk about is diagnosis. Cultural aspects can determine how much support an individual gets from their family and community when it comes to mental health. It influences how people describe and feel about their symptoms. It can affect whether someone chooses to recognize and talk about only physical symptoms, only emotional, or both. In Kenya, patients are more likely to present their physical symptoms than their emotional symptoms. This in turn affects their diagnosis and treatment plan. Many decades ago, mental illness in Kenya was believed to be due to supernatural power or possession by evil spirits. Individuals who believe in supernatural causes of mental ill health refer to places of worship and faith healers as alternative to psychiatrist and psychological treatment. In my opinion, while some cultural practices hinder the effective management of mental illness, it highlights the opportunity to create new frameworks for working with culturally diverse populations. Culture significantly impacts various aspects of mental health, including the perception of health and illness, treatment, seeking behavior, and coping style. So, my fellow here is going to continue the rest of the points.
Okay, so as Cheryl had concluded earlier, she talked about some certain treatments on the mental health disorders, and she did talk about something that I will talk about. There are four categories of treatment. There is the medication, there is therapy, there is support group, and there is also traditional healing or faith healing. As for now, I'd like to talk about two major types of treatment, and that is medication and therapy. As far as medication is concerned, the most common type of medication or treatment available is psychiatric medication. Now, these drugs don't cure mental health problems, but they can just ease some symptoms that a mental health patient can have. So the type of drugs that are offered will depend on your on your diagnosis. For example, the examples of this medication may include antidepressant, sleeping pills, um, minor tranquilizers, mood stabilizers, and amongst others. So that is on the medication. And when it comes to the second point, which is on therapy, we need to realize that therapy treatment provides a regular time and space for you to talk about your thoughts and experiences and maybe to explore the different feelings with a trained personnel, whether it is a therapy or a psychiatrist. And this could actually be helpful to mental health patients who need to deal with a specific problem that they may be having, maybe if it's trauma or anything of that sort, maybe stress. Another thing is to cope with upsetting memories or experience, which I've talked earlier on trauma as an example. Also to improve their relationships, whether it is with families or with friends or with a loved one, and also to develop more helpful ways of living his or her day-to-day life. So one may, hear various terms used to describe talking treatment, including counseling, psychotherapy, therapy, talking therapy, or psychological therapy. Now, these terms are all used to describe the same general type of treatment. There are all lots of different kinds of therapy available in Kenya, and it is important to find a style and a therapy that one may feel comfortable with. And amongst the therapy that I would like to talk about, and this is in conjunction with what I do, which is performing arts, there's something that is called, there's a type of category that's called arts and creative therapy. So in arts and creative therapy, these are ways of which one can use performing arts such as music or dance and drama to express their understanding and their understanding of the person with a therapeutic environment and with a trained therapists, and more so this is common with the music therapy. And this can especially be helpful in to find a different to find basically how difficult mental health patient has when it comes to expressing his or her feelings. And as far as treatment is concerned, I would like to leave it at that. I would like to touch something small on financing and advocacy, where, according to the World Health Organization report, they realized that there are three things that are missing when it comes to funding, and that to financing. That is insufficient funding, unfairness in financing, and effectiveness of the spending that is done to support the mental health program. When it comes to insufficient funding, we get to see that only 2% of countries are able to use the mental health part, the uh, health allocation funds on mental illness and mental treatment and mental awareness to be in general. And we get to find that 2% is really a very low amount of funding when it comes to treatment and trying to prevent and try to diagnose a patient, because in Kenya there are a lot of patients who are facing through mental illness, and we get to find that financing the treatment, whether it's the equipment, whether it's personnel, it's normally a little bit low. And we also need to realize that a majority of funding goes to the hospitals where there are more patients, but rather they have forgotten to fund the community, where they forget that some members of the mental health who are facing mental illnesses are part of the community, and would also ask the government to spare some funding for those who for the part of the community that can help with the training of community members on and sensitization on how to deal with mental health patients. And maybe if I can speak something small on advocacy, where the best actors when it comes to advocacy will be those of the people who have actually faced mental health issues, whether it's schizophrenia, whether it's binge eating, whether it's issues with depression or anything of that sort. We need to find out that we need to the government and the community basically need to educate and train these people who have faced mental health issues to be advocates, the actors basically, not really advocates, um, on how better they can speak and basically try to help those who are facing mental health uh, challenges in our country, Kenya. And for those many points, I think we are going to conclude with that. And that is our short presentation on uh, our cultural aspects of stigmatization, um, mental health prevention, diagnosis, treatment, financing, and advocacy. Thank you very much.
Thank you.
Be well.